The session on urban governance examined how urban interventions during times of epidemic illnesses were justified, carried out, and with what effect, intended and otherwise. Our panelists explored the machinations of politics and city management, their instrumentality and intervention in a time of illness, and the long-lasting impact of each on cities. Our discussant today is Joshua Sharfstein.
Dr. Josh Sharfstein is Vice Dean for Public Health Practice and Community Engagement and Professor of the Practice in Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. He is also the Director of the Bloomberg American Health Initiative. He graduated from Harvard Medical School in 1996, from the Boston Combined Residency Program in Pediatrics at Boston Medical Center and Children's Hospital in 1999, and from the Fellowship in General Academic Pediatrics at the Boston University School of Medicine in 2001. He's the author of the Public Health Crisis Survival Guide, Leadership and Management in Trying Times, and the co-author of the recently released book, The Opioid Epidemic, What Everyone Needs to Know. Previously, Dr. Sharfstein held positions as the Secretary of the Maryland Department of Health and Mental Hygiene, the Principal Deputy Commissioner of the FDA, and Commissioner of Health for Baltimore City. Dr. Sharfstein is an elected fellow of the Institute of Medicine and the National Academy of Public Administration. He has received several awards, including the J.S. Drottman Memorial Award from the American Public Health Association, Public Official of the Year from the Governing Magazine, and the Circle of Commendation Award from the Consumer Product Safety Commission.
Thank you for the opportunity to comment on this terrific panel called Urban Governance, Politics, and Management. I learned a tremendous amount from the 5 presentations, and I think they all speak to how cities and epidemics have been intertwined in history, and how the power of cities became possible in part because of the need to fend off epidemics. The first presentation by Dr. Sende about the logistics of the first quarantine in Central Europe gave me a real sense of how cities became powerful and organized in order to reduce the effects of the plague. And that included taking some steps that are taken today, like reducing gatherings and establishing quarantine outside the city, and other steps that are very much in use with COVID. In the second presentation, Plague and Government in the 17th Century Cities of Mughal India, Dr. Chita Razvi taught me about how cities had to become mobile and resilient, and the leadership of cities had to be mobile and resilient in order to stay relevant and engaged with the plague. And that was very interesting, that the concept of a government that could exist in different places may relate to the need to fend off epidemics. The third presentation by Dr. Zerimbaf on plague, social dislocation, and urban change in 18th century Istanbul was fascinating because it talked about how some of the major ideas that we think of as related to cities, like urban renewal or consumer protection legislation and activity, were in part because of the need to fend off infection. And it gave me a sense that what we really think about as modern city functions also had profound impacts against epidemics. Indeed, I was the health commissioner of Baltimore City. That health department, which is the oldest continuously operating health department in the United States, came into existence because of the yellow fever epidemics at the end of the 18th century. And so much of that, the Baltimore city government was formed because of epidemics as well. Then Professor Aikenhurst, talking about cholera and short-termism in York, England, really talked about how some cities that were able to show flexibility, investment, and ambition were able to do much better against cholera than others. And so in a way, epidemics became like a selection factor for effective city governments. I really also enjoyed Dr. Greaves' presentation on the sanitation campaign against cholera in Naples, because it talked about how not everything that cities do necessarily works well. In this case, the epidemic really revealed the inequality in Naples, and the fictions that were told to people were eventually revealed by the just relentless logic of cholera. And ultimately, false narratives did not work to protect against disease or to defend the ultimate success of the city leadership. So it was both the sense that cities were able to create power to fight off epidemics, but also that cities failed where they couldn't fight off epidemics, that I really took from this fascinating history. So where does that take us for COVID-19? First, I think we can say that this pandemic has been recognized as a huge urban challenge right from the beginning. We saw that from Wuhan in China to metropolises all around the world, cities, because so many people are in direct contact with one another, remain a huge source of risk for epidemic disease. I think that you saw many cities using their power to address this, and many different urban responses across the world have echoes of the responses to the plague, including the banning of large gatherings, the quarantine, the contact tracing, consumer protection, all the things that we saw. And the cities are striving for that flexibility and invention that were successful with London and cholera, although not all of them were successful. One of the differences, or one of the interesting threads I see today, is that the cities are not only establishing their authority with respect to citizens because of this epidemic, like in the past, but they're also establishing their authority with respect to other levels of government. For example, we see in the United States now that it's the cities that are really calling for mask use. And most recently, we saw that the state of Texas, which has many cities in it, had originally told cities they could not require masks, but as cases have gone up, they have basically deferred to cities. So we're seeing that cities are growing in importance and political importance with this pandemic in the United States, at least, with respect to other levels of government. A few other thoughts that I would make. Certainly, we're seeing with the COVID-19 pandemic, just like in Naples, the uncovering of tremendous amount of inequality. That this inequality is evident in two respects. It is clear in who is getting infected, the high rates of illness, particularly among low income and minority workers around the world and their families. And that reflects fundamental inequality and access to safe housing and nutrition and just resources that allow people to stay away from other people. And then number two, we're seeing inequality among who is dying, and people who have chronic illness, often because of different kinds of social deprivation, are now more likely to die as well. I think that this is also, this epidemic is also uncovering different structures that are just not safe. Just like in Istanbul, there were certain structures that were recognized as unsafe and had to be closed down. I think we're going to be rethinking some of the congregate housing for the elderly, given the tremendous amount of death that we're seeing across the country and around the world in nursing homes. I think that we are seeing very much the fact that the disease has its own logic, the infection has its own logic. It will persist regardless of the stories told about it. And so just like in Naples, the stories about Rome and kind of the myths that were told really didn't help very much. I think we're seeing today that people may be telling themselves stories about whether the virus is going to go away, whether certain treatments are going to be magically effective. But in the end, those fall apart when pressed with the true biological challenge of the virus itself. And so I think we're relearning that lesson, that it's only by dealing with the true problems, the true inequalities, can a city be successful against an epidemic. And otherwise, we're going to continue to see a tremendously high levels of death in cities that have significant inequality. Two last thoughts. One is, I think that the COVID-19 pandemic is raising some fundamental questions about urban living and urban design. And understanding those issues is going to be extremely important. There are many people who fled cities when this virus hit. And clearly they were people who had the ability and the means to flee the cities. But I think the question of how much is going to come back is very much active. And I think really understanding where cities were successful and where they weren't is going to be very important for people's confidence in urban efforts. And there may be some aspects of urban design that will need to be rethought, and certainly some areas of urban inequality that will need to be dealt with in order to have a more robust and successful response. So just like we saw epidemics lead to a number of different kinds of changes, hopefully in this case, the pandemic will lead to more changes addressing some of the structural issues that have been fostering infections. And I guess that gets to my last point, which is I was thinking as I was listening to these historical presentations that the epidemic itself led to different kinds of structures in cities. And so I was starting to think, well, what kinds of new structures could this current epidemic create in cities? What kinds of ways of governance? What kinds of new types of policies? How are we going to be able to take the lessons and the successful practices and institutionalize them to strengthen cities over the long term? An example of that might be as cities develop contact tracing teams to shut down the spread of virus in communities. Can those contact tracing teams be repurposed for other things related to health? Can they support people who are vulnerable at home? Can they create new ways for older adults to do better in their community rather than go to nursing homes? Can we take the actual response capabilities of cities and turn them to the challenge of making cities healthier over the long term? So in a way, that is what happened historically. Some of the core infrastructure developed for epidemics made cities stronger, and I really hope that will happen again this time. So thank you very much for the opportunity to comment on these fascinating presentations.